Hey guys, this is Dr. Hub. Today we'll look at the differential diagnosis, and this is going to be of the microcytic anemia. So what does this involve? So first is we are looking at the iron deficiency anemia. So under the iron deficiency anemia, we look at the serum iron. So there is serum iron. So under serum iron, there is the serum iron is going to be less than 60 mg per microgram per dl. Then comes the serum ferritin. So in terms of serum ferritin, it's going to be less than 20 microgram per liter. Then comes the TIBC. The TIBC is going to be increased. Next is the transferrin saturation. There is transferrin saturation. So this transferrin saturation is going to be less than 15. And what about MCV? MCV is going to be decreased. This is in terms of the iron deficiency anemia. And also the RBC count is going to be decreased. So there's an increase in the TIBC, whereas decrease in the MCV and the RBC count. Then we move on to the alpha or the beta thalassemia. So the alpha or the beta thalassemia, the serum iron. The serum iron here is that it is normal or it can be increased. Then look at the serum ferritin. The serum ferritin is also normal or it can be increased. Then comes the TIBC. So TIBC is going to be normal. And then let's look at the transferrin saturation. The transferrin saturation, this involves it is normal. Then looking at the MCV, MCV is going to be decreased just like the iron deficiency anemia, and the RBC is going to be RBC in alpha and beta thalassemia is going to be normal or it is going to be increased, whereas in contrary in the iron deficiency anemia the RBC count was decreasing. Then lastly, we'll look at the anemia of the chronic disease. So anemia of the chronic disease. So anemia of chronic disease, this involves the serum iron. So there is presence of serum iron. So the serum iron is going to be decreased. Serum iron is decreased. Then comes the serum ferritin. There is serum ferritin. The serum ferritin is going to be increased. So the serum iron is going to be decreased. The serum ferritin will be increased. Then comes the presence of TIBC. TIBC is going to be decreased here, whereas in terms of the iron deficiency anemia it was increased, and when we look at the alpha and beta thalassemia it was normal. Then after TIBC we will be looking at the transferrin saturation. This transferrin saturation. So in terms of the transferrin saturation, it is normal or it is decreased. And then let's look at the MCV. MCV is going to be normal or decreased. Then comes the RBC count. RBC count is going to be normal or it is going to be increased.